So Dr. Petrosino, we now have these new guidelines. We've been waiting, from the CDC, and it really looks like a cautious step forward, but really some good news for a lot of grandparents. Put away the FaceTime, put away the Zoom, and get ready to hug.
Yeah, no, absolutely. And as we heard in the earlier messages, it's not open the floodgates, but it is a first step to being able to return to normalcy, especially for some of our more vulnerable populations.
All right, so I think a big question is, does this mark a turning point in the pandemic now that the guidelines are out and they do give a green light to fully vaccinated people to be together indoors without the masks and social distancing?
Yes, no, I think it's a great harbinger and actually gives us a good message for those who are thinking about getting vaccinated or have been concerned that vaccinations are having an impact, a positive impact, and these are just some of the measures that we can bring back into play once enough of the population has been vaccinated.
I do want to mention the CDC defines people who are fully vaccinated as the people who are 2 weeks past their second dose of Moderna and Pfizer, or 2 weeks past the single dose of the Johnson & Johnson vaccine, because obviously it's not like you get the second shot and, boom, you're out there.
Right. So you need time for your immune system to fire and to build up so that it's able to be protective. And as you were talking about earlier, some of the reactions that happen after the first and second doses, they're definitely a nuisance. But at the same time, your immune system's working, and so that's a good thing.
Now, there is that growing evidence that people who are vaccinated don't spread COVID-19, but really scientists are still trying to understand how long this vaccine protection lasts.
No, that's absolutely right, and I think the data are being collected right now, so we should have better guidelines going forward. The concern is that what's monitored during a vaccine trial are really symptoms and disease, but you can be carrying the virus or have a virus or other types of infections for other diseases without necessarily displaying symptoms. And so if you're meeting with people who are vulnerable, there's still an opportunity to spread the virus, and therefore we need more information before more relaxed guidelines can be recommended.
All right, we do want to give everyone the overall update. The new CDC guidance says that people who are fully vaccinated now can visit with other people indoors without a mask or physical distancing, visit indoors with unvaccinated people from a single household without masks and physical distancing, as long as there is that no severe disease. That's a low risk. You could skip quarantine and testing if you've been exposed to someone, but that someone is asymptomatic. But they say you should still monitor your symptoms for 14 days. Were you surprised by any of these?
Not really. I mean, they all make sense, and I think the underlying message. So if you're tracking through, and it's maybe hard to follow all of them, I think the bottom line is that we still want to protect our vulnerable populations or the people that are at risk for severe disease. And so if there's any risk for exposure whatsoever, or if you're around people you don't know their vaccination status, that's when you should be still practicing the measures, wearing a mask, social distancing, as you were before. But if you're in a small setting or a setting where there's no one around who's susceptible to severe disease, that's when these relaxed measures can come into play.